Welcome to week 10. Just a reminder, there is no textbook reading this week. You will just look at this PowerPoint and lecture to complete your assignments. So we'll be talking about risk management and communication in dental this week. So what is risk management? Risk management is a term that describes a philosophy of risk identification and system of injury prevention. Management means that once a risk is identified, it is measured for the seriousness of the potential outcome and the likelihood of its occurrence. So we want to see how likely is this risk going to happen and how can we kind of prevent it from happening. So we then create a strategy to handle the risk in such a way that we minimize it or eliminate it altogether. So how does risk management relate to dentistry? An example would be a general dentist practice may not want to provide complex oral surgery procedures or even endodontic procedures because the dentists there have determined that the risk factors are too great. The liability is too significant and the risk is not really greater than the benefit it would provide for the dental practice. So in this case, the risk management strategy is not to do the procedures there, to leave it to the oral surgeon specialist to do it instead. So how can we identify risks? First, we want to develop well-targeted procedures that help minimize adverse outcomes. We can report incidents. So when we're reporting incidents, we want to include all of the details of an accident or any weird situation. That way we can determine how it occurred and what ways that we can change that situation so it doesn't occur again. This should include patient care problems, patient management issues, patient complaints, the who, what, where, when, why of the issue as well. So risk identification also should include a quality improvement program. This is a system that's used to collect information that will lead to the improvement of the workplace's procedures, processes, outcomes, everything that they do really. It should be ongoing, not just a one-time thing, because the key point of this program is to monitor any patterns of behavior. So if an incident occurs 3 or 4 times, obviously something is going wrong during that process, and that's what we need to examine. So it's really important to keep up with this and work on it over time, anytime some type of issue or adverse outcome occurs. It should include, one, all the structures, so facilities, equipment, organization, admin, personnel, and dental records of the office. Number 2 is to examine the processes, so anytime the doctor diagnoses something, the sequence of care, appropriateness of care, their technical skill, and how timeliness the care was. And then 3rd, outcomes, so was there oral health improvement and or general health improvement as well. So then next is quality assessment. We need to assess these programs as well. So it is a program that assesses the quality of the patient care for the purpose of improvement. That is the end goal. We want to improve upon what we're already doing. So it must include designing a study, collecting data, analyzing the data, reporting the results, responding to the results, design and implement strategies as well. And then lastly, once that's all done, we need to evaluate how effective these strategies actually work. That's the most important part, is the evaluation. We can design things all we want, but we need to see, did that actually work? Did it help at all? Did it make things worse? How did this improve our business? Next, we'll talk about risk reduction. So there are 2 universally accepted strategies to manage risk reduction. Number 1, good documentation. As dental healthcare professionals, we know how important good documentation is. From front desk, doing calls with patients or receiving emails from patients that go into comm logs, to us writing our chart notes after we see each patient. So why is good documentation important? 1, it helps with patient safety. It helps reduce the risk of adverse events, dental errors, and patient harm. 2, treatment planning. It contains information about the patient's treatment plan and care so that we're able to see what was done in the past and what needs done in the future. Also from a legal standpoint, it can be important when we are responding to any lawsuits or submitting even dental benefit claims to insurance companies. And then overall, it just provides an opportunity for us to evaluate the quality of care that we provide. And then number 2 is careful communication in the care and treatments of patients. So effective communication between dentists and patients is vital in the field of oral health. So it can help ensure patients receive the right care, understand their diagnosis and treatment options, and that they feel supported as patients. Poor communication can lead to patients not receiving appropriate care and can also increase the risk of dental malpractice claims, the risk of being sued by a patient. Next, documentation. So documentation also protects both the patient and us as dental health care professionals. That dental record is a comprehensive ongoing file of assessment findings, treatment services, dental outcomes, notations, any contact we have with the patient. So all of these entries in our dental record should be signed and dated. That way, in case a patient decides to go through any litigation or malpractice claims, we have all of the evidence right in front of us. It's signed, dated, and that just helps keep us safe as well as our patients safe. So getting more into the dental record. Again, if any type of legal action is initiated, that dental record is going to be that vital document that either protects us or doesn't protect us, depending on how well we write the chart notes. All patient contacts, both orally, over the phone, or in person, and any written communications need to be recorded, including any cancellations the patients may have if they cancel their appointment, no show to an appointment, and any time that they request information. If they have a question about maybe a procedure that they went through, a procedure they have upcoming, even financial information, all of this needs to be documented. Dental records should include the following: personnel data, so their address, their phone number, ways to contact them, their health history, their dental history, care and treatment, so any assessments that were performed, anytime they give informed consent, we are providing them with medications or anesthetics when we're doing treatment on them, post-op care, post-op instructions, patient education, and then also any notes from conversations we may have with the patient. Dental record guidelines. So dental records should be consistent for all patients. The dental team should be familiar with the state laws. Dental offices should develop guidelines in a common format for the order of treatment notes. A lot of offices have what's called auto notes, where you can just click a button. That way that the notes are in a similar order and formatting for every single employee at the office. Not everyone utilizes that, but you should still try, as a group office, get all of your notes in at least the same format so they're easier to read and understand. The dental record should periodically be reviewed and updated as needed. Entries should be clear, concise, legible, and permanent as well. Any errors should be corrected by an additional entry. We should never be deleting stuff completely from our records. And then any commonly understood acronyms should be used so that all staff members are familiar with the meanings of terms. If there's some bizarre type of acronym that most people may not recognize, just spell it out, or if you use it multiple times in the note, spell it out the first time, put in parentheses the abbreviation, and then you can use the abbreviation on the rest of the note. But if you just start out the note with a random abbreviation that may not be recognized, it's really hard to understand what the note's even about. Communication. So communication is key to a successful, safe, and satisfying dental office. We have to communicate with everyone every single day. Communication ensures that the needs of the patient and ourselves are clearly being conveyed. It's also essential between the dentist, any colleagues in the office, and other healthcare providers as well. So if we refer patients out, or any type of communication with other offices, we have to have that professional level of communication. And us as dental professionals use various levels of communication skills on a daily basis. So how can we communicate successfully? The success of communication depends on how the material is presented, the attitude of the speaker themselves, the tone and the volume of the voice, and the degree to which the other party can listen effectively. So next we'll talk about communication failures. Lack of appropriate vocabulary or use of jargon or words that are unfamiliar to the patient can be really hard for patients to understand what you're even saying. So we need to make sure that we are using layman's terms, terms that not just us as dental professionals understand. So if you're talking about a radiolucency on the distal of tooth number 14, a patient really isn't going to understand what that means. So when you're talking to the dentist, that's perfectly fine. But if we're talking to the patient about an issue they may have, the treatment for an issue, their diagnosis, things like that, we need to use regular terms. So I would say there is a large cavity or area of decay on the back side of your back molar, just to make sure that they're understanding exactly what we're saying. Avoid judgmental or negative tones as well. Patients don't want to feel like they are being belittled or judged for an issue that they may have. So try to use neutral or even positive tones when talking to patients. And dental professionals should stop periodically to check whether the patient comprehends with the information they're being given. So asking if they have any questions, if they understand, as you go along. That way you don't get to the end and they're like, I have no clue about anything you just said. Try to figure that out early if they're following along or not. Communication also requires good listening skills as well. So concentrate on central themes rather than isolated statements. You want to listen in paragraphs, so don't just focus on the first thing that someone says. Take in everything they say and process it all. Listen with an open mind rather than focusing on emotionally charged words. Try not to get your emotions involved. It can be hard sometimes, but if you're to just have an open mind when listening, you're going to receive the information much more clearly. Summarize in your own mind what you have heard before you speak again. So take a second before you respond. You don't have to quickly blurt out things, but just take a second to process exactly what was said, and then you can start speaking. And last, clarify positions and statements before proceeding. Don't allow vague or incomplete ideas to go unchallenged. So if you're unsure of something that was said, maybe ask like, oh, was this what you meant, or can you explain this more to me? Make sure that you are understanding it fully before you start speaking. Next, written instructions. So after performing dental procedures, written post-op instructions are commonly provided to the patient. You should also verbally be telling the patient these things as well, but how many patients are going to remember everything you say if you're listing off maybe 5-10 things that they need to do when they leave this appointment? Most aren't going to remember them all, so giving them a written copy is very helpful. The written instructions should be clear, concise, accurate, non-contradictory, so that's huge. Like, you can't say that no eating or drinking for 4 to 6 hours, but say eat soft foods right away. Like, we have to clarify that. It can't be confusing either. And always give them an opportunity to ask questions after you give these post-op instructions. See, do you have any questions about these instructions, or any concerns even? That way they can ask before you just send them on their way and they're very confused. Next, let's talk about nonverbal communication. So nonverbal communication is absolutely critical in the dental office because a lot of times our hands are in the patient's mouths. They can't even respond if we may ask them a question or just to check in on them. So facial expressions and gestures are super helpful even if the patient cannot talk. Reading a patient's eyes is a common method for gauging a patient's reactions to a diagnosis or a treatment method you may be offering. If they're kind of going against it, they may have a worried or confused, scared, upset look on their face. If they're okay with it, they may just have a neutral type face or nodding in understanding. Patients also receive nonverbal communication skills from us as well. Example, frowns of concentration can often be misunderstood as a frown of concern or criticism. So if we're just almost have like our resting face is kind of angry looking, the patient may think that we're upset with them or are judging them in some way, even if we're not. So we have to be careful with how our faces look when they're talking with us, or if we're even just working on them and concentrating on what we're doing. As healthcare providers, we are seeing a wide range of patients, so we do need to be sensitive to any cultural and ethnicity differences in patients that we treat. What is normal in one country may be completely different than what it is in the United States. So we need to keep that in mind as we're seeing patients. Some differences, such as race or how people dress, are more obvious, while other differences are a little bit harder to ascertain. Even a generational gap between a younger patient and an older patient can be very vastly different. So we need to understand all different types of ages, genders, cultures, just so we can give our patients the best type of care. Individual risk management, which includes continuing education. So as dental professionals, we need to be familiar with the requirements for continuing education. We just went over this last week. As EFTAs, there are continuing education requirements that we have to follow to renew our licenses. So all continuing education courses should be carefully evaluated in the terms of quality that they present and also how credentialized the presenters are. So we don't want to take CE courses from someone who just started in dentistry last month. They're obviously not going to have the knowledge and skills yet to provide you quality information. So you really have to look into where this information is coming from and the quality of the information as well. Poor quality continuing education that gives outdated information or even incorrect information can put you and your patients at risk. So we have to make sure we are getting pretty much the best information possible. It's updated, it is current, it is correct information. That way we're not putting ourselves at risk for losing our license. So we'll go over a few other methods for reducing individual risk. You can join a professional association, such as the ADAA, the American Dental Assistants Association. They also have a Pennsylvania Dental Assistant Association, the Pennsylvania Dental Association, Harrisburg Area Dental Society, so many good professional associations that you can be a part of. They offer CE courses. Just being around other people in the same field is helpful as well. Number 2, maintain a good working relationship with colleagues in the dental office. You obviously don't want to be fighting with anyone in the dental office. That can cause a lot of issues. Be respectful to patients, of course. Be cautious about personal conversations, jobs, or inappropriate behavior that can be misinterpreted, especially around patients. You don't want to be having a lot of private personal conversations with your patients. And then never provide treatment which you are not qualified, educated, experienced, or licensed to perform. And then lastly, we'll talk about social media. So social media can be a good thing and it also can be a bad thing. As a good thing, it can be used for networking, promoting oral health, and giving patients knowledge about different oral health products that may be on the market. The same legal and ethical standards applied in the dental office should also be applied to social media. So patient information must be kept confidential. Any breaches of privacy could result in civil and criminal penalties. Every time you post something online, it leaves a digital footprint that often cannot be erased. You can post something for 1 second and someone may screenshot that and it's there forever then. And then lastly, keep boundaries. Don't add your patients on social media.